Amanda set her sights out on becoming a nurse the moment she left high school. She had an empathetic heart and she really wanted to help those in need. But after 9 months of being a graduate registered nurse, she realised it's not what she expected. She's copying abuse and she doesn't know how long she can last in the profession. Let's hear what she has to say about what she wants to see in the next government.
My name is Amanda. I am a registered nurse and midwife, and I've been in the role for approximately 9 months.
What made you want to become a nurse and midwife in the first place?
I think I have, the personality that's quite caring and empathetic, so I wanted to, take that into my future and be able to ultimately help people on their worst of days and make them feel that little bit better.
Reports show that many nurses go to work prepared to be physically and verbally abused, with the number of assaults against Victorian healthcare workers jumping by 50% in the past 5 years.
It wasn't until I started working that I have personally experienced violence in the workplace, just when I am trying to help as well. So there's been instances in which a lot of the patients I've worked with are confused or do suffer from mental health issues and are not quite aware of what they are doing. But there's been times that I've been punched, been verbally assaulted, especially by family members, and I've had patients try to hold on to me and break my arm as well. A lot of the experience I've had is with older people. So there have been a number of times in which I've helped clean up bodies or resuscitate and be able to feel the CPR breaking people's ribs, which you don't realise how, traumatising it is until you're actually in the workplace.
Opportunities for time off are few and far between for healthcare workers. Critical understaffing coupled with increasing demand resulting in longer hours and less leave.
Like I'm still full of, adrenaline doing the work that I do, coming home and being able to rewind with, an 8.5 hour turnover. It's just not possible to be able to get enough sleep or just recoup after a night shift before starting it all over again.
To ensure a sustainable and supported path forward for healthcare professionals, Amanda is calling on the government to focus on resources, retaining staff and rest for an overworked and understaffed industry.
I think I'd like the government and those in charge to really listen to the people who actually work in the workforce, so they're able to get a real understanding. No one knows what nursing and midwifery is like when they haven't worked a day in it. So I think the best way to get change to happen is to actually listen to the people that are directly involved with it.
The number of practicing healthcare professionals is dwindling, with Amanda now questioning how many years she sees herself pursuing nursing amidst the long hours and lack of institutional support.
There have come points in the 9 months I've worked already when I have said to myself, this is not a lifelong career. It's not something I'm going to be able to do for many more years. I've probably set myself a goal, and that's at the best, of working in a hospital for 3 to 5 years before seeking a job elsewhere. But that's, me really pushing myself. I would hope to still be here in that time, but again, considering how hospitals are at the moment, it's awfully tough to, even want to stay in.